You can't learn math if you're hungry, if you're sick, if you're emotionally distraught. Our mission is math, English, science, and social studies. Teaching math, English, science, and social studies and being successful at that can only happen when we have students who are healthy, happy, and feeling good about who they are and where they're going.
I have to hand it to Joe Spiccia, the superintendent of Wickliffe, who really had a vision around helping each and every student be successful in school. And what he saw were barriers sometimes to academic performance that had very little to do with someone's intellectual ability to understand material or to learn. But it was more so that they weren't prepared to learn. They were hungry, or there was housing instability or healthcare challenges that were going unmet. And I thought, hey, there's an opportunity here where Signature can come in and at least be some of that answer and provide some of the healthcare services. Signature Health is a community health center that has partnered with Wickliffe Schools in order to be a part of the Family Resource Center. We are a healthcare provider, but a specialized one that really focuses in on those people who find themselves at the lower end of the socioeconomic scale.
The Family Resource Center is actually open to anybody regardless of zip code, regardless of family status, and regardless of income or age. That makes us very unique in terms of other resource centers.
Here at the Family Resource Center, we are really providing comprehensive healthcare. So this includes primary care, behavioral health, oral health, and these are co-located. We are collaborating with members of the school, from students to nurses to administrators, to be able to meet the health needs of students certainly, but then as well the community members.
Well, it's a great fit for Signature to be here at the Family Resource Center. One of their mottos is they wanted the Resource Center to be a one-stop shop, which is very similar to Signature Health, as we are also a one-stop shop for healthcare.
Having the Signature Health and the free physicals here, we practice literally like a couple steps away from here, so we could come here after practice. Like if we don't have a ride, you're already here, so it's very convenient to have that.
Just being partnered with the school, with the students, and being able to provide, vaccines, immunizations to students so they don't have to go elsewhere and they can do it here while they're in school and they don't miss school. So it's just to help the community, which is, ultimately what Signature Health is for as well.
Many students have unmet mental health needs, whether that's unmet depression, anxiety, a history of trauma, as well as chronic health conditions like asthma. And we know that those can negatively impact their attendance and their performance. And through having a clinic like we have here, we've been able to address needs for all of those reasons and been able to see success in those students.
Having that captive audience really helps us to interface with them more regularly, see them in their environment to know whether or not that kid is doing well today or not. So it allows us to access not only a segment of population we don't normally, but in a different way, and that's what's really critical.
If a child is expressing any kind of emotional or behavioral needs or concerns to people at school, or that people are noticing at school, they can make a referral to our counselors. So they provide individual counseling. We do a full diagnostic assessment. We can offer family counseling, and we also can link them to other services within the community.
When I've told people who don't live in Wickliffe about what we have here in Wickliffe, it almost brings tears to my eyes, because I wish every community had a place like our resource center.
We have sometimes kids who are struggling really badly in school, and we are able to work as a team with the guidance counselors and administrators and work with them to help motivate that child or deal with whatever issue or barrier there was to them getting to school or performing better. Then to see that child come to school and thrive and see the grades improve and see their moods improve and then see them graduate. It's just great for us to see that. And whether it's a phone call or someone walking through those doors, we're going to try to help them as best that we can.
I feel like I was put on this planet to do this work. and to help spread this and to really try to take care of our community. I get up and I'm excited every day to walk out the door and to see what else we can do to expand the impact that we can have on the community.
That's one of the reasons I like working here, is just knowing that we can serve both the students, the families, and overall, the community.